A new headache for President Obama's signature legislation, the Affordable Care Act. Data discrepancies from millions of enrollees who signed up for health care plans may mean they risk losing generous government subsidies or possibly losing coverage. John Harwood joins us now from Washington with more on all of this. Okay, so John, you got to tell us what's going on here. And what does this tell us about the success or maybe failure of President Obama's health program?
I don't think much, actually, Susie. What this does is this reflects the work of a federal contractor in taking information that people filled out when they enrolled for Obamacare, and then the government had to match that against other databases they had about your income, about your Social Security status, about your family status, all that sort of thing. Most of those, as they have been examined more closely, have been worked out in a favorable way, but you still have a lot of people, a lot of information kicking around in different databases, and I think that what we haven't seen so far yet is fraud, and that would be the real threat to Obamacare. We haven't seen that so far.
What is the nature of these discrepancies?
Well, for example, about half of what we've seen so far has to do with people's income. And how does that work? Well, if you enroll and seek a subsidy under Obamacare, it's based on how much money you expect to make. You estimate your income for 2014. The federal government then matches that against the last available record they have, which is what your income was in 2012. Well, things change. And so if you estimated your income too low and you deserve more subsidy, or if you estimated it too high and you have gotten more subsidy than you deserve, that gets reconciled on your next tax return, if not before.
Oh, that just sounds so messy, John, trying to get that money back. I mean, so let's say you did get money you weren't supposed to get. How does the government get it back, or vice versa?
Well, when you fill out your taxes, the subsidy you get under Obamacare is going to be one part of that form. And so when they see what you filed and what you've earned, they can figure out, and that's part of the calculation of how much tax you owe or how much tax you're going to get back, just like with any tax filing and any tax credit people get.
Very quickly, no one's going to try and make political hay out of this, are they, John?
You saw a ton of that this afternoon. Republicans in the House Ways and Means Committee are having a hearing next week to explore this. They see this as one more bit of evidence that the program was poorly rolled out and poorly designed. Democrats say the opposite. Public opinion isn't likely to shift a lot as a result of this.
John, thank you very much. John Harwood reporting.